Hey guys, Dr. Paul here. So a lot of patients ask me about wisdom teeth extractions and whether they should do it or not. Reason being is often because when you think of wisdom teeth, you think of it's going to be painful, it's going to be a difficult procedure, swelling afterward, bruising, 2 weeks of agony. Although that happens in some cases, it doesn't always. Today I'm going to be showing you a case where we took this lady's wisdom tooth out in less than 1 minute. So this lady came in with pain around her wisdom tooth area. She'd actually been to see her regular dentist about 2 weeks earlier. They gave the area a very thorough clean. It helped a little bit, then about a week later, got a bit worse. And then 2 days before she came to see me, it got really bad, and the day before was terrible. So she called us, we fit her in at lunchtime, and we actually did the extraction. What we actually see here is that this is the wisdom tooth here. Now the problem is that the gum is actually growing over the top of it. Now because of that, food gets stuck in underneath the gum here. When the food gets stuck there, it's very difficult to clean out, and the bacteria, they eat all of that food. That doesn't go down very well with our body. So the gum actually gets swollen, inflamed, infected. As it gets swollen, the teeth up the top start to pinch down on the area. The result is that she couldn't close her mouth because it would pinch on the gum. She couldn't open her mouth because of the swelling and the pain, and she was in huge agony. Now we discussed a few options. One is that we can just re-clean the area, but it's likely going to happen again. Or number two is that we can take the tooth out. Now she actually decided on having it taken out. So because she's pregnant, we did a low dose X-ray. Now as we can see on the X-ray, the tooth, which is this guy here, it's got nice conical roots, which means that the roots aren't going in different directions. It makes the extraction easier. I can also see here the outline of the nerve of her lower jaw, which shows me that we are quite some distance away. So should be a relatively straightforward extraction. It turns out that it was. Here's the procedure. So after making the area in the tooth numb, I then take a sharp probe to feel around the tooth, and I want to make sure, number one, that the patient is actually feeling numb. Number two, we're actually starting the process of severing those fibers that hold the tooth into the gum and the bone. After we confirm that, we then switch over to a luxator. And a luxator is an instrument that we use it as well to sever those fibers, but the other way that I use it is kind of like a lever. So we basically drive the luxator in between the tooth and... Hey, just a thought while you're watching. If you're getting something out of the video, hit the like button or hit the subscribe button. It really helps me out a lot. The bone, and then with a very soft, gentle, but firm twisting motion, we're actually levering the tooth upwards. So you can see we've actually got a lot of movement here on the tooth, and it hasn't really been very long at all. And because of how the gum's actually positioned over the back of this tooth, it was stopping it from coming out. So if the gum wasn't like that, it would have come up straight away. But what I've had to do is I've switched to a larger luxator. I've moved the gum away a little bit and then just changed my angle slightly to get the tooth up and out. Now I want to make sure it doesn't go down her throat, so I try and grab it with my fingers and then pop, it comes out. And that's the tooth. Oh my God. So she was actually asking, was that the tooth, just because it happened so quickly. Now I want to mention, because you can see that there is a hole that is there where the tooth used to be. This is completely normal. Now that hole is going to fill with blood and a blood clot is going to form. And then over the course of about 2 weeks, eventually the gum will start to line that area. After that, you will then have bone that fills in the area. That takes about 3 months for it to happen properly, up to about 12. But don't worry, that space will fill in. Don't worry about that. Now I actually called the patient the next day, as we routinely do, to see how she was feeling. She said she's feeling a whole lot better. The problem is that it was a little bit sore to swallow. Those things are normal after you have teeth taken out. She then called us the next day to say, hey, crisis averted, it's feeling a whole lot better. She was in really minimal pain. She was really happy that she had it done. So I guess the take-home message is, look, the wisdom tooth extraction, it sounds like it's going to be bad, but it may not be as bad as you think. It may not be anywhere near as bad as the pain and the agony that you're currently in. So what I'd suggest, go to the dentist, go for a consultation, see what can be done about it, and work out, is it going to be a hard procedure, is it going to be an easy one? You may be surprised. Anyway guys, thanks for watching. Keep on smiling.